testosterone. I'll use that one. Okay, now that's too much, though. That's the problem. Anyway, even if you're doing surgery, these supplements are going to help you because remember now, when you do surgery, the ultimate healing is because of stem cells. You have a surgical wound, it heals only because of stem cells. So anything you can do to enhance the healing is a smart thing to do. Okay. So what are some of the conditions that promote these inflammatory cytokines? Well, we have basically declining sex steroids, testosterone, estrogen, obesity, we know that, smoking, subclinical bacterial infections. I was just talking to someone in the audience here who was talking about stem cells, and I said, I think you still may have an infection, and in the view of an infection, I probably would not do stem cells. Arteriosclerosis, diet, glucose. Glucose we know is a bad thing. It causes so many different problems, and excess calories. Now, adult stem cells have enough trouble. When I put stem cells in there, I'm lucky if 3% of the cells will survive. It's a very harsh environment. I put them in a knee joint, hip joint, a very harsh environment for cells. They don't like it there. There's no real good oxygen, no nutrient supply. It's really a tough area for them to really survive in. So what are some of the inflammatory markers we look at? Tumor necrosis factor, the interleukins, the cycloogenases, lipogenases, et cetera. So there's multiple factors that contribute to the low rate of survival. And again, we're talking about the extracellular matrix. That's basically the largest composition in the body, the extracellular matrix, the largest organ in the body. So tumor necrosis factor, and in this we don't really need to dwell on. Basically, you have the acute part and you have the chronic part. And it's found in almost all bad inflammatory conditions, osteoarthritis, et cetera. You have C-reactive protein. Again, you can have the acute phase and you have the chronic phase. And it does coat the damaged cells, and it's a recognition by the immune cells. Then you have the cycloogenases and the lipooxygenases. Okay, again, you have the chronic and you have the acute stages. Again, there's no reason to go over this in detail. Now, if we can eliminate inflammation, though, we can turn off a lot of different diseases, okay? Now, what do we do to eliminate inflammation? Well, we know that anti-inflammatories can sometimes help eliminate inflammation, but, the body's trying to heal it when they have inflammation sometimes. And we all know now that we're somewhat reluctant in giving these anti-inflammatories to our patients. There's a lot of bad things, liver, kidney, et cetera, et cetera. I'm a little concerned giving a lot of my patients these anti-inflammatories because they do a lot of harm. So what's the root of inflammation? Well, we think the root of inflammation is basically the formation of free radicals. And the problem is we have to use oxygen, and when we use oxygen, we make a free radical. Now, I heard that term. I said, but what really is a free radical? Well, it's pretty simple. Here we are right here. Here we have the oxygen molecule, very nice, stable molecule, not a problem. Here we have an oxygen atom. Okay, that's a free radical, basically, right there, that electron. That free electron is what does the damage, okay? And what does it damage mainly? It damages our mitochondria. The mitochondria is the powerhouse of the cells, okay? Also, another interesting thing, think of mitochondria as chloroplast. Mitochondria are very sensitive to light, believe it or not. Just another little aside that we'll talk about later. So anyway, here's a sort of unified theory of aging. We're talking about shortened telomeres. We're talking about P53 activation. This is all from the work of Dr. Pinero at Harvard. This was actually from an article of a good friend of mine, Dr. Bill Andrews. But basically what happens here is the damage goes right here. Mitochondria failure. When you get mitochondria failure, you've had it. Your cells had it. There's nothing you can do. It's the end game, so to speak. So you have to try and prevent that free radical damage to the mitochondria. So where do these free radicals come from? The environment. They're internally produced by our own bodies. Stress, absolutely, stress is a big producer of free radicals. We know now that stress can make the difference between success and failure in many different surgeries. It can radically affect the healing process. And then there's a chain reaction of free radicals. Now, these free radicals are cellular killers. They damage the DNA. They alter biochemical compounds, such as growth factors, et cetera. They destroy the cell membrane, and they can destroy the cells outright. Now, one of the things we have to look at when we're dealing with free radicals is something we've all heard about, and we kind of know a little bit about, but not that much. It's called the ARC, or the oxygen radical absorption capacity. What does this really come down to? These are what we call antioxidants, okay? We all heard of, we need antioxidants in our diet. Well, that's what these antioxidants do. They balance these free radicals. Now, there's a lot of different foods that have various antioxidant properties. Anybody know what probably the best antioxidant in the world is? Anybody want to venture a guess? Take a guess, someone. Something that you all, not all, but most people like to eat a lot. Garlic's a good one, but no. Dark chocolate. #1 antioxidant in the world. Look at this study right here. Look at green tea right here. We know green tea is a good thing, right? And avocado. Look at all these things that are good. Broccoli, seedless raisins, but look at dark chocolate right there, okay? So maybe we ought to mix dark chocolate with your broccoli or something. The problem with chocolate is when you mix it with sugar, you start getting problems. But dark chocolate alone, eat it every day. It's one of the best things you could do. Now, free radical fighters are basically antioxidant fighters. They're called phytonutrients, okay? You know, these basically are the skin and of the fruits and vegetables and the color. You need to eat 5 different colors a day to really get something good. That doesn't mean to eat 5 different kind of M&Ms a day because that's a lot of sugar in it, so you don't want to do that. You want to eat 5 different colors a day. That will help you somewhat, okay? So the best methods of fighting free radicals is diet, exercise, and supplements, okay? So diet, a sensible diet, a Mediterranean diet, low in bad fats, low in bad carbohydrates, low in red meats. There was just something this morning how red meats are bad again. It was on Good Morning America. As I was getting dressed, I was listening to it. So the Scripps Institute out in California has this kind of anti-inflammatory diet. It's a Mediterranean diet. Again, 5 different colors a day. Exercise, very important, okay? The best thing you can do is try and get your maximum heart rate up to about 85 of what it should be, 85%. Now, that varies from age. But what do we have? What happens when we do this? Guess what? It has our body secrete human growth hormone. I'm not a big proponent of giving patients human growth hormone. I think there's a lot of potential side effects. Oh. So where do we go from here? Okay, Mr. AV man. So anyway, okay, we just have to keep going. All right, so we'll go past this a little bit. We'll be back on exercise. But when you exercise with 85% of your max cardiac output, you're going to naturally increase your human growth hormone. And I think when you do it naturally, I think that has some very good things. Human growth hormone, I'm a little concerned about. I'm very concerned to give it to my patients who basically may have a cancer. I don't give it to them, as a matter of fact, because of the fact it's a controversy. Some people say it will stimulate your immune system. Other people say it will stimulate the cancer. I don't use human growth hormone anyway. I use IGF-1, which is made by a bacteria. It's a recombinant bacteria. I use a company called Guna. This is where I get all my growth factors from. So anyway, something to realize. But also we need to do resistive exercises also. Now, supplements, very important. Can they slow down aging? We think so. Can they reverse some of the aging? Maybe. Can they help stem cells? Absolutely. Okay. So what are the best supplements for our purposes? Omega-3 fatty fish oil, resveratrol, phytonutrients, vitamin D. I think any surgeon that does any kind of open surgery, any little incision, needs to put his patient on vitamin D. It's such a potent antibiotic-type agent. Okay, carnosine, Stem XL, curcumin. Okay, there's a brand of curcumin out there. I'm going to give you guys a pearl now. There's a brand of curcumin out there called Ultra Cure. The problem we have with curcumin, which is turmeric, a superb anti-inflammatory, but the problem we have is it's not very bioavailable. Well, this particular form is 15,000 times more bioavailable than anything out there, okay? Another thing we like to use sometimes is something called fucoidan, okay? Fucoidan is an algae from Okinawa. Now, anybody that knows about the people in Okinawa, they have some of the longest longevity in the world, and their diet is very rich in fucoidan. Fucoidan basically has a lot of vitamin A in it, so we know that that can stimulate cells. Among other things, it stimulates those very small embryonic-like stem cells. Nitric oxide production, okay? The problem you have with nitric oxide, and a lot of people know they want to use L-arginine, but after age 40, L-arginine doesn't work so much. As a matter of fact, it sometimes makes free radicals. So you now have a product from the University of Texas called Neo40. And it's basically, it's a little pill. It's from a derivative of a beet, of all things, and it dramatically increases nitric oxide production by a bacteria modulation. Now, also, I want to tell you one thing. If you use a mouthwash, you're killing this bacteria, you're going to dramatically decrease the amount of nitric oxide your body's going to make. So just bear that in mind next time you use a mouthwash. And another good compound I'm using is CH-alpha. This is something that really helps restore the collagen balance in joints and things like that. This comes, I believe, from, it's either UCLA or USC. Very good research. The company's German, but they've done some good research out there, so it shows very good science to it. Omega-3 fatty acids, again, this is fish oil. The thing you need to worry about here is the EPA, DHA. Nothing else is of real importance. You want to get about 3,000 a day of those two numbers combined. So when you look at a fish oil product, don't look at the total number of fish oil. It's 3,000 of EPA, DHA. You may have to take 10,000 of fish oil total. The other trick with fish oil, put it in the freezer, much better absorption, doesn't bother your stomach, etc. Again, fish oil will basically reduce inflammation. It has a little effect in preventing it. So it's something I still recommend people take every day. The omega-3 acids can affect the cell membrane. And again, it's the eyes and ears of the cell. And there we saw this slide earlier, but again, just to kind of reiterate a bit. Now, interesting studies that have been done with omega-3 fish oil. They did a study, I believe, in some prostate cancer patients. This is from American AMA Journal. And they found that basically the telomere degradation was much less in the people over a 5-year period that took fish oil. So remember now, telomeres are the secret of aging. You know, all these diseases that are bad diseases, Alzheimer's, this and that, are all associated with short telomeres. So if you want to have a reason to take fish oil, this is one of them. All right, so basically, we think it may help increase telomerase activity. And again, we saw this slide, so we don't have to belabor it. Resveratrol. Okay, now resveratrol is basically, we call it the French paradox. You know, and people in France have not the best of diet. It's very rich in cream and other bad things, and they smoke a lot as a population. They don't like to necessarily exercise a lot. I hope I don't have too many French people I'm going to offend here. But basically, their rate of heart disease is very low, and we think it's because resveratrol is there. It works by mimicking the effects of calorie restriction. We know that calorie restriction is the only thing that scientifically is shown to slow down aging. And they've done it with fruit flies and other insects. Okay, but basically resveratrol stimulates a certain gene. It's called the SIRTIN1 gene. It's normally inactive after age 40. Unfortunately, a lot of our genes become inactive. They become silenced, okay? This work was performed at Harvard University by Dr. Sinclair. He's now working in unison with a couple of the pharmaceutical companies to see how they can bring this to market and probably charge us a lot more money than we should be paying. But it does mimic calorie restrictions and exercise, so it's an important thing to take. The question is, what's the dosage? Don't know. I mean, I myself take 500 milligrams a day of the trans-resveratrol. We know a glass of red wine has between 0.5 and 1 milligram a day, so I'm taking a lot of red wine there, but it's probably, I'm not really getting good absorption. So I'm hoping I may get the absorption of maybe 1 or 2 glasses of wine a day. And again, something to bear in mind with most supplements, anything that's really usually good for you, one of its side effects is acts as a blood thinner. So be careful. Ask your patients what else you take. Are you on Coumadin? Are you on Plavix or something else? Because it could affect that. So you just got to keep that in mind. And gene silencing, we talked about that. Again, that's why we develop cancers as we age, because certain genes become quiet. They're quiescent. Whereas a 20-year-old may have those genes working, a 50-year-old may not, and he can develop cancers. Now, vitamin D, okay? At least 2,000 genes are basically directly influenced by vitamin D. It can affect our health in so many different ways. I mean, we could spend a week just talking about vitamin D. You have conferences just talking about vitamin D. It can do so many different things, okay? It's most important because it upregulates cathelicidin, okay? Guess what? This is a broad-spectrum antibiotic. The only thing I know of that can kill both viruses and bacteria. So vitamin D is very bacterial and viral static and kills it, okay? Now, here's something, evidence from New England Journal of Medicine, a very respected journal. We can see all the different things vitamin D does. It goes from, you know, osteomalacia, hypertension, Alzheimer's, to basically common cancers. We know that people in northern latitudes in the winter have a much higher incidence of cancer because of the lack of vitamin D. So it's a very, very important thing, okay? So what type should you take? You have your patient take vitamin D3. That's the best one to take. Cod liver oil sometimes is not the good thing to take, okay? And usually 2 to 5,000. I'm going now 5,000. And I like to get my patients to have a blood level of about 100, at least, maybe more. Vitamin C is important in the production of collagen and therefore cartilage. Also acts as a good antioxidant. Stem XL is another compound. This comes from the University of South Florida. It's from the work of Dr. Bickford and Dr. Sandberg and everything. And basically, these are the various things in your vitamin D, carnosine, blueberry extract, green tea extract, and a variety of enzymatic extracts. Now, it's dose-related, and these seem to work synergistically. Now, interesting, this compound, at least in the laboratory, and then sometimes in the lab and in real life are two different things, but this compound can basically stimulate something called granulocyte colony stimulating factor, basically GCSF, which is about $1,000 per injection, and also can have one potential complication, death, whereas this stuff has nothing like that whatsoever. So anyway, melatonin is another one we like. Melatonin, yes, it helps you with sleep, but guess what? As we age, our levels decline 10 to 15% per decade. And what melatonin does, among other things, it's a very good free radical scavenger. It's better than glutathione or vitamin E. It protects their DNA from injury. Matter of fact, what they do for soldiers where they think there's potentially a problem that they may be exposed to radiation from one source or another, they'll give them melatonin to take with them because it does protect from radiation damage. And a lot of this work on melatonin comes from my good friend Dr. Ritter at the University of South Texas, I believe. And he shows what some of the things can do. Among other things, it's the ultimate antioxidant, and it does protect our mitochondria. Remember, without the mitochondria, you're in trouble. So the melatonin dose, half hour before bed, you can take that dose. Sublingual ones work the best, and that's it. Now, cholera, basically, it stimulates our immune system. It's an algae, and it's something that seems to work pretty well. Astragalus. There's one called TA65, a compound made from this. Absolutely does show that it increases telomerase production in the body. So it will make your telomeres a little longer. It's very expensive. Probably not necessary that you purchase it because you can get something very similar in many different good health food stores. And SOD is basically another type of enzyme found in all living cells. This is something that can be given as a supplement also. And glutathione, the problem with glutathione, it's very difficult for us to absorb it. We basically have to produce it, so we need to go get something called N-acetylcysteine, which can help produce glutathione, so it's an important thing to take. Arginine, we already talked about this. After age 40, you're not going to produce much nitric oxide. So you need to get on this other compound, Neo-40. That's why they have the number 40 in here, because after age 40, you're going to do more harm than good. Nitric oxide, basically, like I say, it's the holy grail of stem cell therapy. It produces large numbers of hematopoietic stem cells from the marrow. It acts as a signaling molecule. So if you can give your patient a nitric oxide stimulating compound, it's as if you're giving them hyperbaric oxygen. You know, it's too expensive for me to give the patients hyperbaric oxygen and too time consuming. So I'll just give them a Neo-40, and I'm going to be very happy because they're going to get this thing. Now, Neo-40, basically nitric oxide, is also the way a lot of these medications for erectile dysfunction work. Basically, they're increasing vascularity. So I have a lot of patients that tell me anecdotally that it works better than Viagra, and it's much, much cheaper. Fucoidan we talked about. Again, it's a complex carbohydrate from a brown seaweed, near Okinawa. It helps express the CD34s, which are hematopoietic stem cells. A lot of people in the supplement world think that the fucoidan is the plant equivalent of mother's milk, which is thought to be the ideal thing to nourish someone. It's very important in the Okinawans. And bovine cholesterol is basically, again, found from the milk in the beginning and has a lot of different growth factors in it, as you can see. Hormones are important. You can't overemphasize that. I myself am not involved with that. I let the internist or whoever get them balanced. I'm not a hormone replacement expert. I'm an orthopedic surgeon who does stem cells. Again, testosterone, estrogen, thyroid. We talked about that earlier today, how important the thyroid is now for osteoporosis, et cetera. Now, the cytokines, we're going to kind of end up with that. Basically, everything that we deal with is an imbalance of cytokines, okay? Now, these are the bad guys. Interleukin-1, tumor necrosis factor, interleukin-6. When we're talking about osteoarthritis and inflammatory reactions, et cetera, it's these guys right here. These are the ones, when you do a PRP in someone, the PRP is attempting to nullify the action of these guys. So interleukin-1 causes swelling, degradation of blood vessel walls. inhibits production of collagen, inhibits proteoglycans. Basically, it stops collagen production and cartilage production in its tracks. It really does damage there. It's a master anti-inflammatory cytokine, as is tumor necrosis factor. Cellular apoptosis, dehydration, necrosis, basically overrides anabolic repair. And the problem is the PRP will last only about a week, and then it starts running out of growth factors to fight these guys. Interleukin-6, another bad one, okay? Metabolic syndrome, drives pain and inflammatory processes. This is the one, for instance, if you're dealing with a patient with sciatic nerve irritation, it's typically interleukin-6 that's really the culprit getting after him. Now, who are the good guys? Well, we have interleukin-1 antagonist. Interleukin-10, one of my favorite guys, insulin growth factor 1. Okay, so basically interleukin-1 antagonist basically goes after interleukin-1. It's a master antagonist. It helps prevent inflammation. It's almost always included in any kind of cytokine therapy that we do by mouth or by injection. Interleukin-10, the best way I can describe interleukin-10, it's a form of like cortisone, but no baggage of cortisone whatsoever. No bad, really, side effects. It works wonderfully, and I mean, it can get rid of the pain very, very quickly. IGF-1 is the insulin growth factor, basically the active form of HGH, human growth hormone. Stimulates anti-inflammation, stimulates glycoprotein synthesis, basically does a lot of good things. So these are the main cytokine mediators for osteoarthritis, the ones I just mentioned. So we're going to end up with a little bit about the lasers. Okay, so we do lasers and basically nitric oxide antioxidant therapy, low-level laser therapy, and they release nitric oxide. Okay, so again, we talked about the arginine and things like that, but realize after age 40 you're going to start having a problem. You won't get to this point. Now, what activates gene transcription? Near infrared light, we think, can do that. It can affect the mitochondria to a very good degree and do it. So mitochondria, we think now, are the body's chloroplasts. Believe it or not, they are sensitive to light, and they will respond to lasers and things like that, and it helps them make ATP production. So basically, to give you an idea of some of the lasers, now we're using lasers on the surface, we're using lasers intravenously, and we're using lasers intra-articularly. Some of the best work on lasers comes from Russia. I happen to be working with a doctor from Germany called Dr. Michael Weber, who's really, I think, took this science to the next level. Now, we'll show you what happens when we have blue laser light intravenously. Here's a red blood cell right here, okay, erythrocyte. We're going to hit it with some blue light, laser light that is now, and what does it do? It starts releasing nitric oxide, and we get a perioxynitrate, and then that perioxynitrate, which is a free radical, goes back into the erythrocyte to the hemoglobin, and it gets reduced. And we've now had nitric oxide that's produced. And so we have great increased bioavailability, free radicals are reduced, and basically it shifts the redox state to reduction. So basically when we hit it with red light, we'll show you what happens here. Someone was asking me earlier about ATP production. Well, here's what happens when we hit it with a red intravenous light. ATP synthesis. We get way more ATP. Okay, and then the downstream effects of the low-level laser therapy, transcription of stimulatory genes, anti-apoptosis, and increased stem cell proliferation and differentiation. And basically just shows you some of the growth factors involved. Now, this is a very interesting slide. This comes from a friend of mine. This is basically the essence of everything I'm talking about for these last two lectures. We have stem cell therapy, we have PRP therapy, photobiomodulation, nitric oxide, and all these various things. Now, here we have the various paths of immunity, Th1, Tho, and Th2. Some of these represent chronic diseases, things like that. This is all tied together, but it's a very complicated slide. I have to look at it, and every time I look at it, I learn one more little facet of it. But this is everything, pretty much. So we have nitrophotonics. Basically, biostimulation can balance the immune system and balance homeostasis. And again, one thing I want you to go away with, mitochondria are the principal photoreceptors. That's what makes lasers work so well, because it affects the mitochondria, among other things. And just to give you an idea, this is the intravenous laser that we're using, the various colors right here. We'll have various colors, maybe 20 minutes each, depending on what we want to try and treat. When we have a very inflamed joint, we'll put a blue laser into the joint itself. That seems to calm things down. When we want to go for healing, we'll use a red laser. But we'll do this in conjunction with stem cells and things like that. We don't just do this alone, at least not right now. And then we use the intra-articular one you can see right there. And that's it. Thank you so much.